I decided to do my presentation on Langerhans cell histiocytosis because my mother was diagnosed with it at the age of 2 years old, and I just thought that this would be a really interesting disease to learn more about. Now we're going to start with the description of the disease. So Langerhans cell histiocytosis is a disorder in which excess immune system cells called Langerhans cells, which are members of the dendritic cell family, build up in the body. Langerhans cells, which help regulate the immune system, can normally be found throughout the body, especially in the skin, lymph nodes, spleen, lungs, liver, and bone marrow. In Langerhans cell histiocytosis, the cells multiply abnormally. Instead of protecting the body, the cells cause massive tissue injury and destruction, especially in the bones, lungs, and liver. This disease appears to be a disease of the immune system in which immune cells multiply abnormally and promote inflammation and damage to surrounding tissues. Langerhans cell histiocytosis can develop in only one site in organs, or it can involve several different sites and organs. However, in most cases, when it affects many body systems, it's typically in children younger than 2 years of age, whereas single site disease may usually occur in people of any age. Now we're moving on to the history of the disease. The Langerhans cell was first discovered by Paul Langerhans Jr. in 1868. Langerhans was a German physician and anatomist. He discovered the Langerhans cell when he was merely 21 years of age and a practicing medical student. The first case to ever be reported of LCH was by Alfred Hand in 1893, and it was of a 3-year-old boy with polyuria, exophthalmos, and hepatosplenomegaly. After that, similar cases were reported by Henry Christian and Arthur Schuler. Due to that, the disease was named Hand-Schuler-Christian's disease. However, other diseases had similar histopathological patterns, so they then decided to classify Hand-Schuler-Christian disease as well as the other ones as histiocytosis X in 1953. Later on, it was renamed to Langerhans cell histiocytosis in 1985, and it has not been changed since then. Now we're going to be moving on to the signs and symptoms of the disease. So in children, there are plenty of symptoms, but I do want to make it clear that sometimes symptoms don't even show. People don't even have symptoms. But in children, the symptoms may include abdominal pain, bone pain, delayed puberty, dizziness, ear drainage that can continue long term, eyes that seem to stick out more and more as time goes on, irritability, failure to thrive, fever, frequent urination, headache, jaundice, limping, mental decline, rash, seborrheic dermatitis of the scalp, seizures, short stature, swollen lymph glands, thirst, vomiting, and weight loss. Now, in adults, there are not as many symptoms, but the symptoms do include bone pain, chest pain, cough, fever, general discomfort, uneasiness, ill feeling, an increased amount of urine, rash, shortness of breath, thirst/increased drinking of fluids, and weight loss. However, the symptoms for children over 5 years of age tend to only have bone involvement, so that's kind of like bone pain or, signs on the bone such as lesions, things like that. Now, causes of the disease. So due to the rarity of the disease, the exact cause is unknown. So researchers have studied the possibility that a common substance in the environment, such as a viral infection, could possibly trigger the disease by causing the immune system to overreact. However, they are yet to identify a possible infection or substance that could trigger the disease. Other theories have suggested that the primary cause of Langerhans cell histiocytosis is an abnormal immune system. There has been plenty of debate as to whether or not Langerhans cell histiocytosis is an inflammatory immune disorder or a cancer-like condition. Scientists have found that histiocytosis shows gene changes, mutations, in early white blood cells. This leads to abnormal behavior in the cells. The abnormal cells then begin to increase in various parts of the body, including the bones, skin, lungs, and other areas, resulting in collections of tumors in various parts of the body. Also, as I mentioned in my intro, my mother was diagnosed with Langerhans cell histiocytosis at the age of 2. And turns out my grandmother's best friend's child was diagnosed with it as well, prior to my mother. They lived within the same area, and due to the little research on the causes of this disease, it is very possible that geography or something in that area possibly played a part as well. Now, how is the disease diagnosed? So, due to the rarity of the disease and the fact that the symptoms are similar to other illnesses, it's often hard for doctors to diagnose immediately, and it may take some time. Nonetheless, a doctor may start with examining the areas of your body where you have symptoms. If you have bone pain, then you may get an x-ray done as well as a bone scan. Your doctor may also request blood scans, chest x-rays, and even an MRI scan of the brain if they suspect that your brain is involved as well. From there, if Langerhans cell histiocytosis is suspected, then a biopsy as well as a microscopic examination will be done with a part of the affected tissue to confirm whether or not the diagnosis is true. If the biopsy comes back positive, then other tests may also be done to figure out the extent of the disease and just how bad it is and what needs to be done from there. Now, moving into the pathophysiology of the disease. I found it to be quite hard trying to find the pathophysiology on this disease. There are many things that have not been looked into and or researched about LCH. Due to that, I will be basing these statements off of my mom's case as well as other ones that I was able to find. My mother had a lesion on the back of her head, which was thought to be a tumor, but it was ultimately a lesion where the bone was destroyed by the Langerhans cells and it had filled with fluid. She also had a lesion on her hip where the cells had attacked there as well. Now, I was also able to find another case where a man had inflammation on his face because he was diagnosed with LCH orally. As well as that, there was another case of a young child with gingival growth and swelling/inflammation due to oral LCH as well. It's clear from those cases and other ones that I was able to research on that lesions, rashes, sores, inflammation, and even masses are common in this disease. Now, I did include an x-ray where it says a discrete punched out bone lesion in the upper femur is shown in the picture, as you can see right there in the very top of the hip. Now, moving on to the prognosis of the disease. Prognosis of the disease depends heavily on whether or not the initial presentation was low risk or high risk. More than 50% of kids under the age of 2 with LCH having spread over their entire body will sadly die of the disease. Now, if the disease has spread throughout the body, then it's likely that the patient will die within 1 to 2 years. If the disease is localized to a specific area, such as specifically the hip or specifically the mouth, it is possible for them to have a prolonged lifespan. As for people who have been treated and don't have more lesions between 12 to 24 months, it is expected for them to make a full recovery. Now, as for when there is lung involvement, the prognosis is not as good and follow-up is necessary at least twice a year. Patients with isolated skin involvement or solitary lymph node involvement do tend to have a good prognosis. However, it is important to note that around 50% of patients that are diagnosed with LCH are prone to many different complications, such as, but not limited to, diabetes insipidus, liver cirrhosis, skin scarring, musculoskeletal disability, and etc. Now, moving on to the epidemiology of the disease. So, Langerhans cell histiocytosis is considered to be a rare disease. So, age. It is said to occur in around 1 to 2 newborns per million each year. Moreover, the number of cases for children between the ages of 0 and 15 are said to be around 4 new cases per million each year. The disease is more likely to occur in children under 15 years of age. However, it is very possible to occur at any age. Now, the frequency. There are around 1,200 reported new cases in the US alone each year. It is believed that the disease is more prevalent in white people and Hispanic people than other races. Sex. It has always been reported that the disease is more prevalent in males than in females. For every 2 male cases, there is 1 female case. Now, there are variants of LCH, so that also plays part in the age of onset of the disease. For example, letter C disease mainly occurs in children under 2, while Hand-Schüller-Christian disease has its peak of onset in children between the ages of 2 and 10 years of age. Now, management of the disease. So, Management of the disease really depends on what organs are involved and just how severe the case is. If the disease is isolated and in one single site, then observation is an option, along with possible surgical removal of the area as treatment. As for skin lesions, it is possible for them to clear up on their own, especially if they showed up during infancy, but they can also be treated with topical steroids or thalidomide. As for systemic involved cases, then chemotherapy and radiation may possibly be used. Currently, chemotherapy protocols are using prednisone and vinblastine. However, other options include vincristine, cytosine arabinoside, prednisone, and pamidronate. Lastly, follow-up with oncology is mandatory because there are always possibilities of complications showing at later times. Like I mentioned before, they are not limited to, but diabetes insipidus, secondary cancers, hearing loss, and growth failure. There are more, but those are just a couple examples that I wanted to provide. Now, I did want to actually talk about my mom's story because this is the whole reason that I decided to do this disease and research it more, because I knew that my mom was diagnosed with it as a child, and it's always interested me to learn more about what exactly she was diagnosed with. So, when my mom was 2 years of age, my grandma began to notice that my mom drank a lot of water and was going through diapers like crazy, to the point where she would have to wrap towels around her when she was sleeping so that she wouldn't pee all over the bed. My grandma took her to the emergency room, where they admitted her right away and kept her overnight to examine her symptoms. They immediately noticed that her urination was excessive, and they transported her to Children's Hospital in Los Angeles. Now, my grandma was familiar with the symptoms of diabetes insipidus because her sister had it. However, not for the same reason that my mom has it today. The doctors told my grandma that anytime someone has diabetes insipidus, it's most likely because there's an underlying condition going on. Although there are plenty of symptoms for the disease, my mom's were very simple. She did not have many signs and symptoms. So she did have excessive drinking/urination, she did have the lesion on the back of her head, and she didn't really like to walk, which possibly could have been because of the lesion that she had on her hip as well. Now, turns out they found that my mother had a lesion on the back of her head as well as her hip, and they diagnosed her with Langerhans cell histiocytosis. What was found out was that the Langerhans cells had damaged the back of her skull and caused a big lesion filled with fluid, and the cells also did damage to her pituitary gland. Due to that, the doctors were unable to know the full extent of the damage to her pituitary gland, and she was kept in the hospital for 30 days, where they ran tests, did exams, and removed the fluid from her skull. Chemotherapy was done afterwards for 1 year to clear up the lesion on the back of her skull and hip until they healed, and she also had to take 18 pills every morning for that entire year. The doctors told my grandma that they would not know the full extent of the damage done to the pituitary gland until my mother went through puberty, because it could have stunted her growth, and people with this disease are rarely able to have children. However, she did hit puberty, and she has 4 miracle children and lives a normal life, besides her diabetes insipidus, which causes uncontrollable thirst and urination, resulting in her having to take desmopressin acetate for the rest of her life. She continues to get checked every 5 years to make sure everything is well, and other than that, she is healthy and happy. Now, this is actually a short video that I wanted to include that can better explain the damage done to the pituitary gland because of LCH.
This is a case of Langerhans cell histiocytosis, or LCH, of the pituitary gland and infundibulum in a 6-year-old male. The first image is sagittal T1 weighted with some motion degradation. It demonstrates thickening of the infundibulum and pituitary gland itself with classic loss of the typically hyperintense posterior pituitary. The non-contrast coronal T1 correlate redemonstrates the infundibular thickening as well as enlargement of the pituitary gland itself. The third image with T2 weighting in the coronal plane redemonstrates the thickening of the pituitary stalk. The multiplanar post-contrast T1 weighted sequences demonstrate avid post-contrast enhancement of the markedly enlarged infundibulum and pituitary gland itself. LCH is a reactive clonal disease of monocyte macrophage system and may affect almost any organ system. LCH CNS involvement may fall into one of several forms, such as osseous lesions with or without soft tissue components, intracranial extraaxial lesions, such as in the hypothalamic pituitary region, meninges, or circumventricular organs, intracranial, intraaxial lesions, and cerebral atrophy. LCH is the most common cause of infundibular thickening in childhood. Diabetes insipidus is the typical clinical presentation of hypothalamic pituitary involvement.
Okay. Now, moving forward. This is some extra research that I decided to include because a lot of this stuff was very interesting to learn more about, and I wasn't able to include it in the other slides. So I did want to add to the fact that 1 to 2 newborns are diagnosed per million each year. So there was roughly 3.8 million babies born in 2018 in the USA, which means that LCH occurred in only about 3 to 7 of those babies. When you look at it like that, it's kind of clear why LCH is considered rare and why research on this disease is still ongoing and can be hard to find at times. Now, an interesting fact that I read about patients with the disease is that the family members of the patients, such as kids, have a higher incidence of developing thyroid disease. Also, if one has LCH of the lungs, then it's more than likely that smoking is associated with it. It is believed that the disease is actually underdiagnosed because some of the symptoms are very similar to the symptoms of other diseases, or they can often be diagnosed as an injury. Also, it's even possible that some people don't show symptoms at all. Like I mentioned, my mother barely showed any symptoms. I named off a ton, but she only had about 2 or 3 of them. The disease is not contagious, and it's not even believed that it's inherited. Experts still debate over whether it should be coined as an immune dysfunction or as a type of rare cancer. Hematologists and oncologists are the main ones to treat children with LCH. Now, because LCH affects less than 200,000 people per year, it is considered to be an orphan disease and does not receive significant funding from the government. So funding to be able to continue research and more relies on donations from individual people and contributions from foundations and corporations. Thank you so much for watching.